I'm with Jerry Sandbrand, a patient with COPD, chronic obstructive pulmonary disease or lung disease, and a retired dentist. Jerry, when were you first diagnosed with COPD, and can you take me back to that time, what it was like for you?
Yes, well, I had been short of breath way back when I was even a teenager. I had lung functions problems. I didn't realize it at the time, and then I went smoking for up until I was 32. And then went to a respirologist when I was about 55, in other words, about 15, 18 years ago. And the doctor diagnosed me with having COPD and advised me.
And can you tell me about the exercise that you're doing now to help to control the symptoms of COPD?
Well, as I mentioned earlier, the respirologist told me I had 20% lung function. In other words, I had 20% of what a normal person would have at that time, and it remains at 20%. However, on his advice, I began exercising, and which the short story is begin with walking. Try to increase it as much as you can. Do it so that you're uncomfortable, but not necessarily extremely agitated, and do it very consistently 6 days a week. That's a very good little nugget there, and I took it to heart.
Well, that's great. At St. Paul's Hospital, researchers such as Dr. Don Sin are examining ways such as a simple blood test that would make it possible for the early diagnosis of COPD, as well as helping people currently with the disease to manage their condition. What would that research mean to people such as yourself?
Well, the doctor is doing blood work, apparently, that will tell when people who have COPD may have what's called an exacerbation or a flare-up. We're prone to that. And when we get a cold, it goes to our chest, and it is serious. So we need medication, and we need an antibiotic, and often we go into the hospital, which drains a lot of resources. With the doctor's research, and it looks like it's going to happen, is that he will be able to decide, or detect, I should say, when a person becomes susceptible to having this flare-up. And this would be wonderful, because treatment could be started early, even though the person doesn't know, and avoid having to use the hospital's resources and money.
Fantastic. Thank you so much, Jerry.
My pleasure.